My name is Dr. Marrianne Gitau. I'm an otorhinolaryngologist, head and neck surgeon. My areas of interest are in otology, which means the ear and ear issues, and laryngology, which has to do with voice and voice disorders. Vertigo is a sensation of sudden movement. It can be according to the patient's perception, which we call subjective vertigo. It can be according to the movement of the surroundings, which is called objective vertigo. So basically the patient presents with a history of either feeling dizzy, they say they have loss of imbalance, they feel like fainting, or some have actually fainted, or they feel like they're about to fall. So some of the terms can be used interchangeably. Most of the time a patient will not tell you I have vertigo. They will tell you I feel dizzy, I feel like fainting, or I fell. Vertigo has a number of causes depending on the organ, which is the problem. Balance is a function of many organs. The brain as the central controller. You have the eyes, you have the ears, you have the sensors in the spine and in the neck and the muscles of the neck. So vertigo can be classified into peripheral vertigo, which is what we ENT surgeons deal with. That has to do with the inner ear. The ear has three parts. It has the outer ear, the middle ear, and the inner ear. So vertigo is usually a problem with the inner ear, balance and issues of ion imbalance, and the peripheral pathways of the vestibular system. We also have what we call cerebral vertigo. That is when a patient has a lesion in the brain, and the lesion is affecting the part of the brain which has to do with balance. Either it is pressing on it, or it is causing pressure, or there's something that is growing there. So you can have vertigo arising as a result of that. And then we have central vertigo, which has to do with the central nervous system pathways. Most of the time, the patients present to the ENT surgeon after having visited most the general practitioners in the casualties, and they find that when they present with the dizziness or the feeling of imbalance, they end up having other medications given. But when it is narrowed down to the ear and they come, they may tell you that they're having tinnitus, which is a sensation of a ringing noise in the ear. They may also have a bit of a lightheadedness. The patient will complain about nausea. They feel like they want to vomit. Some patients actually get to the point of vomiting. If the vertigo is very severe, the patients actually lose balance. They cannot stay upright. And you find that sometimes we actually see them as inpatients when they have been admitted because of loss of balance and excessive vomiting. The moment you notice that there's something wrong with your ears, for example, you feel like your ears, there's a feeling of fullness in the ears, you have a ringing noise in your ears that is not disappearing, you're beginning to notice that you're having problems with balance, especially when you turn your head. For example, with sudden movements of the head, rising up from bed when they sit up from bed, or if you stand up suddenly, or if you bend down to pick up something and you find that you're feeling dizzy or like the room is spinning, then you should actually visit an ENT. If you find that you're walking and you cannot feel your steps, that you're not stable, or you're veering in one direction whereby you think you're going forward, but you find you're actually rotating either to the right or to the left, then you should actually visit a hospital or see an ENT. The two are quite different because, you see, fear of heights is a matter of perception to the patient, whereby you feel that the distance where you are at from the ground is what worries you. So if I stand on the 12th floor of a building and I look out the window, or I stand at the ledge and I look over, it's actually a fear, innate fear in the patient that is making them think that the ground is very far and that they could fall. But that is not vertigo, because vertigo can happen even when you're on ground floor. Vertigo can happen when you're lying down. Vertigo can happen when you're sitting down. So it is not really related to the distance from the ground at which you're standing. The treatment options for vertigo depend on the causative factors. If you recall, I said that we have the cerebral, the central, and the peripheral vertigo. So if it's an issue to do with the brain, then you need to, one, diagnose what is the issue. Can it be treated? Does the patient need surgery to remove that lesion? If it has to do with peripheral vertigo, which is what we ENT surgeons deal with, we need to actually narrow down the diagnosis. Is it positional vertigo? There's a condition called benign paroxysmal positional vertigo, which is very common, and that's what we need to determine. Is it vertigo that is lasting for a long period of time, a number of days? Because we classify vertigo depending on the duration. There's that vertigo which lasts seconds to a minute. There's vertigo which lasts for hours. There's vertigo which lasts for days. So the first step when you come in is to take a proper history and determine how long have you had the vertigo. What are the causes of the vertigo? Did you have trauma to your head? Did you have trauma to the ear? Are you on medication that could be precipitating you to having vertigo? When does the vertigo occur? Is it becoming more severe? Is it becoming less severe? Have you taken any medication? Has the medication made a difference? Do you have any chronic illness? So once we get the full history and then we do a full neurological examination, that basically means that you examine the patient, all the systems to do with the head. You look at the eyes, you examine the nose, you examine the ears, and the other tests that we do within the clinic that are called vestibular tests. These are to determine which ear is the problem. Is it one ear? Is it both ears? Have we narrowed it down to the inner ear? And have you looked at the rest of the ear and found that there's nothing else that is wrong with that ear? That is the first step, the clinical diagnosis. After we make the clinical diagnosis, sometimes we can actually administer treatment at that level. There are medications that we can give that suppress the vestibular system, and most patients respond to those and they don't require any further treatment. There are those patients who, despite the first initial trial treatment, still come back. We teach them some maneuvers that they can do. We have Epley's exercises, Cawthon-Cooksey exercises that deal with the vestibular pathways and the inner ear, and sometimes that corrects the cause of the vertigo. And there are patients who you might need to go a step further, do other investigations like radiological investigations like the CT scans, the MRI. Other patients might actually need to do some lab tests to rule out other medical causes of vertigo.